Don Warne is a member of the Oglala Lakota tribe in Pine Ridge, South Dakota. Dr. Warne is the Director of Indians into Medicine, Associate Dean of Diversity, Equity, and Inclusion, and Professor in the Department of Family and Community Health and Community Medicine at the University of North Dakota School of Medicine and Health Sciences. He is known internationally for his extensive research and countless publications. He has served several years as a primary care and integrative medicine physician with the Gila River Care Corporation in Aseto'ne, Arizona, and 3 years as staff clinician with the National Institutes of Health in Phoenix. During Dr. Warren's time in Arizona, he conducted diabetes research and developed diabetes education and prevention programs in partnership with tribes. Dr. Warne currently serves as an adjunct professor at the University of Nebraska Medical Center, Stanford University of South Dakota Medical School, and is an adjunct clinical professor at the Sandra Day O'Connor College of Law Indian Legal Program at Arizona State University. Dr. Warne is currently a member of the National Board of Trustees for the March of Dimes, the Health Disparities Subcommittee for the Centers for Disease Control and Prevention, and the National Advisory Committee for Rural Health and Human Services with the Department of Health and Human Services. At this time, it is my pleasure to introduce Dr. Don Warne.
It's an honor to be here with you today, and I'll be discussing some things that are very important to me in terms of addressing health, equity, and educational equity for American Indians and Alaska Natives. So the topic today will be impact of unresolved trauma on American Indian health and higher education. And very pleased to be a part of these important discussions. And just to give you a little bit more of my background and how my work relates to this topic, I am a family doctor, and I've worked in Indian health for my entire career. I finished medical school back in 1995, and I've worked in many areas of Indian health since that time frame. And several challenges that I see that are having a big impact on our people from an education and health perspective is the whole idea of unresolved trauma. We have issues related to historical trauma, adverse childhood experiences, and other types of social adversity that are having a direct impact on our people. And I think for most of us who work in Indian communities or are from Indian communities, we know that there's all kinds of social determinants of health, as well as social determinants of educational outcomes as well. And I see those two arenas coming together very closely and very interchangeably, because we know that the quality of education in a community correlates to health status in the community. And because of poverty, we tend to have struggles in both education and health. So very happy to provide this information. All right, so kind of getting started with the presentation. I'm originally from Kyle, South Dakota, on the Pine Ridge Indian Reservation. And the traditional name of this region is Aseto'ne, which means medicine root. So it is the medicine root district of the Pine Ridge Reservation. And where I'm from, in Medicine Root, this is where we also have a lot of our traditional healers who are from here, both in modern times and historically. So I was very fortunate to grow up in a family with a lot of traditional healers and medicine men. So my first exposure to health and healthcare really was through traditional Lakota medicine. My Lakota name is Wichasha, which means medicine man. I was named after my grandfather, Louis Staver. His Lakota name was also medicine man. And I've been very happy to work in Indian health for really my entire career. And when I think about health status and health issues for our people, we have to be cognizant of the fact that we don't have written language in most of our tribes. So we don't have history books that are written by our people. But we do have stories. We do have a strong oral history, and we understand a lot about cultural traditions and history through these stories. And in this region, there is a story of three sisters walking along a river. And as they're walking along the river, they see babies and young children in the water struggling to stay afloat. So the first sister jumps into the water and says, "This is an emergency, it's a crisis. We need to get the babies out of the water right now." And the second sister thinks about that and says, "No, what we need to do is teach the babies how to swim so they can survive while they're in the water." And the third sister keeps walking upstream, and the other two get angry with her and say, "Where are you going? Why aren't you helping us?" And she says, "I'm going to find out who's putting these babies in the water, and I'm going to stop them." And that is public health. That's literally working further upstream. So in our programming here in North Dakota, we've done a lot of training and Master of Public Health level specifically to American Indian public health. And in my current role as director of the Indians into Medicine program, what I like to tell my students is that public health is traditional medicine. And the focus on community health, population health, and wellness and promotion of healthy lifestyles is all consistent with our traditional approaches to medicine and healthcare. So I look at this really, even though it's modern science and we incorporate a lot of data and evidence-based practices into our work, we have to understand that the framework for health promotion in a community really is consistent with traditional cultural medicine as well. I really like this map. This shows the concentration of American Indian population by states. And you can see there's only 7 states that have at least 3% American Indian or Alaska Native population. And for Alaska Native brothers and sisters who might be online now, I apologize. I know Alaska's not off the coast of California, but this is the best map I have to demonstrate this. But there are 7 states that have at least 3% American Indian and Alaska Native population. Of course, that's Alaska, Montana, North Dakota, South Dakota, Arizona, New Mexico, and Oklahoma. And as you look west of the Mississippi River, that's where most of our people are. If you look east of that line, there are very few, or relatively few, American Indians in the eastern half of what is now the United States. And there are reasons for this, and it's important to acknowledge the impact of history and how this nation evolved and its direct impact on indigenous peoples. So the reason the map looks like this is that colonization started in the east. If colonization had started in the west, the map would be flipped, wouldn't it? You'd see higher concentrations in the east. So historically, we had tribal populations throughout what is now the United States, of course, Canada, Mexico, and other parts of the continent as well. But for now, our American Indian, Alaska Native population really is concentrated in the West because of our history. So anytime we're looking at unresolved trauma, we really do have to understand the historical context. And some of these discussions are difficult, and certainly we know that there are challenges related to historical trauma, unresolved trauma, and how this has an impact on health status for people today. So if we look at the time of contact, we know that in what is now North America, there were probably about 20 million indigenous peoples throughout the Americas at the time of contact. And of that number, probably about 5 million in what is now the United States. Well, the colonies, the original 13 colonies, were not good for the northeastern tribes, obviously. And you may have heard of Amherst, Massachusetts, or Amherst College. That's named after Lord Jeffrey Amherst, and he is, of course, very famous in Indian country because he is the one who ordered the distribution of blankets from a smallpox hospital to the regional tribes in the Northeast. And the purpose was to wipe them out. So it's not well described in our history books, at least when I went to school, it wasn't talked about in American history, but it is a real part of our history. And in many ways, we can think of this as the first documented case of bioterrorism was our own colonial government doing this to the tribes in the Northeast. And it's interesting, if you're interested in looking at some of the original documents, you can actually find these online. So you can just Google Amherst and smallpox and find some of the letters that were written. And I like how the word Google is now a verb, so we can look these things up. But this is actually the note written from Jeffrey Amherst to the colonial army captain. And I know it's very hard to read in his cursive, so this is what he said. He said, "You will do well to try to inoculate the Indians by means of blankets, as well as to try every other method that can serve to extirpate or get rid of this execrable or horrible race. Extirpate this execrable race. I should be very glad that your scheme for hunting them down by dogs could take effect." So when we look at historical trauma, and when we look at the whole idea of marginalization and discrimination, and in many ways attempts at genocide against the indigenous peoples of this continent, we have to recognize this goes way back to the original time of contact. And for many of us, the fact that we honor someone like Jeffrey Amherst by naming a city after him, naming a college after him, really is a disservice to our ancestors who were lost as a part of this. So a lot of these discussions are very difficult. It may trigger negative emotions in a lot of our people when we hear about these things. But I think it's very important that we walk through truth if we're ever going to get to equity. And it makes some people uncomfortable, and I recognize that. But it's important to understand the truth of history, to understand the truth of why our circumstances are as they are today in both health and education. Well, we know that in the Southeast, we also lost a significant amount of population and certainly land and resources. And in the 1830s, there was a law called the Indian Removal Act. And the Removal Act basically moved the tribes from the Southeast to what is now Oklahoma. That's more commonly known as the Trail of Tears, right? When our populations were moved from their homelands to what is now Oklahoma. And in that process, within some of the tribes, there were tribal members who refused to be removed. So they stayed in their homelands, while other tribal members did agree to go to what is now Oklahoma. So that's why we have the pattern of distribution of our tribes that we do. So for example, we have Seminoles in Florida and Seminoles in Oklahoma. Cherokees in North Carolina, Cherokees in Oklahoma. Choctaws in Mississippi, Choctaws in Oklahoma. You get the idea. So of the 38 federally recognized tribes in Oklahoma, only 4 of them are actually from Oklahoma originally. So the tribes were kind of split apart, and as you can imagine, that's had a significant impact on those tribes in terms of connectivity to homelands, and certainly connectivity to intergenerational poverty and other challenges just by being removed from homelands. We also know that the discovery of gold was bad for the California tribes. So at the 1850s, many of those tribes were wiped out or significantly reduced in number. There was a time in US history in which there was a bounty and you could legally kill American Indians. This is just really remarkable that this occurred. So this occurred in California where there was a bounty, but also even in Minnesota. I'm connected in from Grand Forks, North Dakota, just a few miles from the state of Minnesota. But in 1862, there was what was called the Dakota War. And during this time frame, the Dakotas, who were in the western part of what is now Minnesota, were moved out to west of the Red River into what is now North Dakota. And there was a time frame when there was a bounty. You can see on the left, the bounty for every, quote, redskin killed was $25. And it was such a successful campaign to get rid of the Dakota Indians, basically my ancestors. The next year in 1863, it says the statewide reward for dead Indians has been increased to $200 for every redskin sent to purgatory. This sum is more than the dead bodies of all the Indians east of the Red River are worth. Now, this is horrible, and this is significant efforts at genocide. This is clearly human rights violations. This is in many ways war crimes. But this is part of our history in terms of loss. I mentioned that it's estimated in 1492 there were probably about 5 million indigenous peoples living in what is now the United States. And by 1900, there were less than 200,000 American Indians left. This is just remarkable. So it was almost a complete genocide. Our population was nearly completely wiped out. The good news is, at the 2010 census, there were 5.2 million self-identified American Indians and Alaska Natives. So our population has rebounded in terms of numbers. But what is the intergenerational impact when we see this type of loss of life and this type of loss of resources, loss of economies, loss of cultures? It has a huge impact on social circumstances, and that has an impact on health and education. So this is from a publication that I wrote with one of my colleagues at North Dakota State University, Denise Lasmedier. We published this in 2012. And this is looking at the intergenerational basis for our chronic disease disparities. And we do have to come to terms with the fact that there was an American genocide, that we nearly wiped out the indigenous populations of this nation. And this, of course, leads to the whole idea and concept of historical trauma. And historical trauma has been defined in many ways. One of the definitions is that it's the collective emotional wounding across a generation that results from massive cataclysmic events or historically traumatic events. And we've already described a few of them. And I apologize that it's triggering for people and creates a lot of negative emotion. I understand that. And the purpose for describing this story and telling the history is not to make anyone feel bad. The purpose for sharing this is that it's the truth. And again, we have to walk through truth to get on the path to equity. So this trauma can be held personally and transmitted across generations. I was just at Carlisle, Pennsylvania, and this picture is from the Carlisle Indian School. And many of our boarding schools have massive grave sites and cemeteries where children were buried. And we saw a lot of excess death at the boarding schools. And we don't know why so many of our children died at boarding school. And we know there were things like outbreaks of tuberculosis or influenza, but it doesn't answer the full extent of excess death that we saw at the boarding schools in the US or residential schools throughout Canada, even in Australia. So this has been a recurring pattern for Indigenous populations worldwide. And we have to remember that each one of those children was deeply loved by someone back home, but they never were able to return home. And when I think about this, I also think about the survivors of boarding school. What's the impact on those children when they witnessed so many of their friends and playmates dying at such an unnaturally high rate? And this is not ancient history. My own mother is a survivor of boarding schools, and this certainly has an impact across generations. So when we think about the boarding school experiences, we have well-documented cases of abuse, neglect, sense of abandonment, forced removal from home, loss of language and culture, loss of traditional parenting and family structure. I think one of the emerging sciences that will help us to understand the impact of historical trauma in boarding schools is the whole field of epigenetics. And some of you might be familiar with epigenetics. And what we see is that people who go through toxic stress have an impact on their DNA. So we can see how stress can actually have an impact on gene expression. So we can actually change DNA just based on toxic stress. And there's been models of this study, and we can see that this impact can cross generations. So I think that epigenetics will probably be the scientific platform for which we better understand historical trauma. Many of you, I'm sure, are familiar with adverse childhood experiences study, different types of abuse and neglect. And what we see is that children who experience a lot of adversity during childhood have worse health status as adults. So the theory behind this is that adverse childhood experiences have an impact on neurological development and then subsequent social and emotional behaviors. And quite often we describe these as the problem children, right? And they might have behavioral challenges. Quite often they get kicked out of school or have challenges graduating from school. So we see a significant impact socially when there are adverse childhood experiences. And then I see a lot of self-medication, whether it's with alcohol, substance abuse, even food. People are self-medicating for the unresolved trauma. And then we wind up seeing health challenges and ultimately early death, unfortunately. So adverse childhood experiences can have huge health implications. Higher rates of obesity, diabetes, depression, even heart disease and cancer are elevated when people have significant adverse childhood experiences. In addition, what we see is adverse childhood experiences have a negative impact on life potential as well. Even graduation rates and academic achievement are decreased based on adverse childhood experiences. So thinking back to that original story of three sisters and that third sister walking further upstream, when we work further upstream and try to address unresolved trauma, we can have an impact not just on improving health outcomes, but also improving educational outcomes. So I really look at the whole field of addressing unresolved trauma as being one of those upstream areas that we need much more attention. The better we can improve early childhood development for our kids as American Indians, the better our outcomes will be both in health and education. Unfortunately, things that we're working on now, we want to improve our understanding of historical trauma. What's the scientific basis for it? What are some of the outcomes for our people? How do we prevent adverse childhood experiences? There's some emerging evidence that home visiting combined with parenting skills can have a positive impact. So what if we could invest in home visiting programs with traditional parenting skills incorporated and work with our traditional healers and really focus on that traditional model of parenting and family? I think we could make a meaningful impact. People have already suffered from adverse childhood experiences and historical trauma. How do we mitigate the impact? How can we improve outcomes, even for those who have suffered tremendously and have unresolved trauma? How can we resolve that trauma? Part of what we need is a diverse workforce. I think that when we have a lack of diversity in healthcare leadership, quite often the health systems don't know what they don't know, right? So they don't even realize they're not providing adequate diversity and services to meet the diversity of the population. So here at UND, we have the InMed program, Indians into Medicine. We admit 7 enrolled tribal members per year into the medical school. So at any given time, we have at least 28 InMed students in the medical school here at UND. I just became the director of the Master Public Health program as well, and we're including Indigenous health in our curriculum. And we're just kicking off a brand new PhD program in Indigenous health, where we can look at things like research and evaluation methods that include Indigenous methodologies and really try to make an impact by growing our own cohorts of health experts to improve outcomes. And I'd like to close with this saying from our sister tribe, the Blackfeet. A child is sacred, and when that child comes into the home, the family must welcome it. And if the child is happy and feels the want, he will come into this world very, very strong. And not to know this is to know nothing. And not to know this is to know nothing. That's very powerful. And in our traditional ways, we respected children. They're fresh from the spirit world. We call them spirits. And we have to recognize that the way we treat our children today is going to have a huge impact for lifelong health and even educational attainment. And I have selfish reasons for this as well. I have 4 children of my own, and here's 2 of them. And I hope that in the time of their grandchildren, what if we no longer have to have this conversation because we've created healthier generations that are embracing the beauty and healthful, meaningful ways of our people from a traditional perspective.